For those of you who don't know who the Grand Families and Kinship Support Network at Generations United is, we are the first and only federally funded technical assistance center on the families. So we support government systems and nonprofits to improve their services and supports for the families. And we are here to provide no-cost assistance to anyone who serves the families and who would like assistance. You can see our umbrella. We try to support the many systems that intersect with grand families and kinship families, and we use those terms interchangeably to mean grandparents and other relatives and close family friends who raise children when parents can't. And because of this graphic on this page that you can see that the families intersect with so many systems, that's why one of the reasons Kinship Navigators are so vital, because they connect all these systems with the families so that the families can get the services and supports that they need. And we can support those Kinship Navigators and all these organizations. So it's a beautiful relationship. On the next slide, you'll see some of the things that we do, including webinars like this. We also host peer learning communities. That individual assistance, we're always ready to help with whatever you need help with, large or small. I need a resource on X. I'd like to meet with these people and find out how they're doing housing, whatever it is. And it's in the top right of our homepage of our website to request that assistance. We're also doing intensive technical assistance based on outreach, based on an application process that we had about 2 years ago. So we are working in San Diego County and Idaho, the state of Idaho, and Oneida Nation of Wisconsin. And that has been really affirming work that we are going to roll out lessons learned next year so that other folks can work cross systems in their jurisdictions. And then that's the link to our website. And on the next page, you will see how you can stay connected with us, which is through the newsletter and through our LinkedIn page, which we try to, we actively post on there, all things kinship, not just the things that we produce. And it's a link to the individual requests as well. So on this slide, you'll see this is a link to a list of the Kinship Navigator programs around the country that we know of, including the 6 evidence-based Kinship Navigator programs that are in the Title 4E Prevention Services Clearinghouse. And because they're in the 4E Prevention Services Clearinghouse, they can draw down up to 50% of all their costs through Title 4E child welfare funding to support their program. And other states and other places can follow those models with fidelity and draw down those funds as well. So that's why we wanted to provide this webinar to you today and really elevate 3 of the 6 that focus on all kinship families. So they don't just serve those families with open child welfare cases, they serve all the kinship families that are outside of foster care involvement as well, which is the vast majority of these families. So on the next slide, you'll see, and this is really the 2 reasons we wanted to provide this webinar in this format, was that you can, if you're not, follow one of these models that you're going to hear about today with fidelity. You complete these forms through the U.S. Department of Health and Human Services, the Administration for Children, Youth, and Families, the Children's Bureau, and you follow their guidance and you submit a Title 4E amendment. And then once that gets approved and you revise your cost allocation plan as a child welfare agency, you can then contract, or you can contract before, with someone, with a nonprofit in the community, with nonprofits in the community to deliver the Kinship Navigator programs. Or you can deliver them yourselves as the child welfare agency, although we like it when it's run through community-based organizations that don't feel threatening to the families and that are trusted by the families. So once that attachment has been approved to the amendment and the cost allocation plan, then they can draw down the 50%. So this is a really great way not to have to evaluate your own program, which we all know, and the 3 programs on this call certainly know that takes time and money, and follow one of them instead, and follow it with fidelity. But you can make some changes, which they're going to get into, and keep what you love at the heart of your program too. So on the next slide, you'll see that there is going to be a Title 4B. So this is another source of federal child welfare funding. or prevention funding. And 4B has had non-competitive funds for these Kinship Navigator programs around the country. For every state has been eligible to get this funds for 6 years now. But this year, this coming year, well, I guess it is this year, fiscal year 26, it's going to be competitive. And so there are going to be less of them, but they're going to be larger amounts. The child welfare agency doesn't have to be the lead applicant. The nonprofit can be the lead applicant. A university can be the lead applicant. They're going to need to show how they're going to cooperate with their Title IV child welfare agency, but it doesn't have to be the lead. Now, we suspect this will come out in late spring, but we will share it through an email blast with all of our newsletter subscribers when this opportunity becomes available. So we wanted to prepare you today by hearing from these three models so that when this opportunity comes up, you're ready to pounce, because we suspect that you're going to have to name a model that you want to follow in this opportunity. So without further ado, and without hogging up more time, I am pleased to turn it over to our presenters. We're going to start with Washington State, and these are three fabulous presenters from there. And you can, I won't go through all their names and butcher them potentially, but you will be hearing from them. And then on the next slide, you'll see the folks that are joining us from Florida and from Foster Kinship in Nevada. So we have a rich array of presenters today. And without further ado, I want to turn it over to Roz Alber to kick off Washington State's share of their program.
Thanks, Anna. I really appreciate being able to have the opportunity to present about our program. The Kinship Navigator program in Washington State has been around since about 2004, 2005 is when we started our program. And then we conducted a research project starting in 2018, and our partners at University of Washington School of Social Work and the Department of Children, Youth, and Families partnered with us at the Home and Community Living Administration to put together this model, the Kinship Navigator case management model. We are kind of unique in Washington State in that we have our children's administration is separate from the aging administration, which is where our Kinship Navigator program is housed. We partner with our local area agencies on aging, and they either directly provide Kinship Navigator services in their communities, or they partner with community partners within their own communities. So we are doing kind of a broad reach out into the whole state with a Kinship Navigator program, but we partner with the University of Washington and with the Division of Children, Youth, and Families in this endeavor. So we will be directly working with our partners at the Division of Children, Youth, and Families to draw down those funds, which is kind of unique to how some other states function. So just wanted to call that out before we start. So we could go to the next slide, please. So I'm going to talk a little bit about the essential components for fidelity to the Washington State model. You can see here this diagram that kind of spells it all out for you, but I'll talk a little bit in more detail about each of those components. So at the top, you can see the program advertising. That is done in various ways. We have a website, and we also have our community partners and the Kinship Navigators do a lot of work out in the communities that they represent and do, attend different resource fairs. They have brochures they hand out and do a lot of networking within their communities. So that's a great way to get the information out. We also have a lot of people that have participated in the programs that are our biggest advocates, and they end up doing a lot of word of mouth as well, which really helps a lot. And then to the next, I'm just going to go around to the right here. Information and assistance is a key component of what we do. We provide resources and information about different resources in the community. So that's a big component of what we have in addition to that. And then the next bubble you see is needs assessment. We have a needs assessment that is conducted for the case management model, and that was developed in partnership with a lot of our community partners, the Kinship Navigators, and those with lived experience as well. So we were really happy that they had a big part of developing this whole needs assessment. We do a 3 and 6 month follow-up, um, build goals and that type of thing, so that that is all a part of the components that are required for our case management model. And then you see the case management bubble directly under that, where we did that with our pilot, but we continue to do that as well. Um, and then at the bottom bubble, you can see that there is a bubble that says urgent funds. In Washington State, we have what we call the Kinship Caregiver Support Program funds that are for durable goods. If someone needs help finding beds for the kids that all of a sudden showed up on the doorstep, or clothing items, or sometimes help with rent or utilities because someone has to move to accommodate that larger household. We have all those funds that are available. Those are all state dollars. Our Kinship Navigator program is also funded through state dollars. So we recognize that not all states have that same setup. As far as following fidelity, the model, you would just need to have something in place identified to serve people's needs for urgent funds or their urgent needs. Like, where would you find resources and supports to help support them with those types of items that I just named off? So something in place. If you don't currently have something in place, you could always develop something or a partnership within your communities. We also have peer-to-peer support as part of our components. That could be something like support groups of all different types. You could have a support group that's virtual or in person, activities. We also have kinship navigators that most oftentimes kinship navigators also are either kinship caregivers themselves or former kinship caregivers, so they have that element of lived experience to kind of tap into as they're communicating and working with families. It's really helpful to kind of help build that rapport. And rapport is key. Building that relationship with the family has been really pivotal on the success of our program. So that really helps kind of build that relationship with folks. Then we have the bubble on the far left that's caregiver education. Caregiver education is pretty broad. There's only one required piece of education, and that is a training, and that's required through the Clearinghouse. Is that we conduct a training on trauma, and it's pretty broad, so there's not any specific guidance about what that means. So we've been doing that with our caregivers and also with the Kinship Navigators, kind of as a group, so they can participate in this trauma training. We have created a partnership with one of our subcontractors that hope are gratefully put together a training for us every year, but you could also do something on your own. There's Dr. Crumbly has wonderful trainings, the inherent strengths for kinship families, that's available. There are other kinds of trauma trainings out in the community as well. So you don't necessarily have to reinvent the wheel. You can just tap into a resource that's already available. And then you see the program oversight. We have a kinship care oversight committee that conducts a lot of oversight and acts kind of as a sounding board or a advisory committee for us. It is made up of community members, kinship caregivers, coalition leaders, support group leaders, kinship navigators, all the agencies that have some sort of touch point with the kinship caregivers. So it's really been pivotal in helping to put together some advocacy statewide to help support our program and to help support kinship caregivers. We've really used them and leaned into them as our guidance to help develop this program as well. So they're just, and it's also a requirement to follow fidelity to have something that's similar to that. It doesn't have to be an exact replica of that model. It could just be you might have some pre-existing group that gets together that you could connect to and use as your oversight committee. So that's just another example of what you could do with that. Um, I think I've covered all the pieces of the elements at this point, so I'm going to turn the next slide over to John to talk more about the outcomes of our program. Thank you.
Thanks for that description of the program components, Roz. So after the case management model for the Kinship Navigator program was designed, our team at the University of Washington partnered with the state to evaluate how well it works for kinship caregivers and the children in their care. And to do this, we set up a quasi-experimental design study based on the specifications of the Title IV Prevention Services Clearinghouse Handbook. And that was carried out between July 2019 and July 2023. So in this study, we compared a range of outcomes for caregivers and the children in their care who received the case management model of the Kinship Navigator program with those who received services as usual from Kinship Navigators. So I'll highlight a few of the areas where we saw statistically significant results that were sustained 1 year after case closure. So for caregivers, those who received case management services were about 5 times more likely to attend kinship care support groups. They were about 3.5 times more likely to receive assistance with accessing legal services and information, and about 1.5 times more likely to agree that they feel better able to cope with caring for their child. And for children, those whose caregivers received case management services were about 3.5 times more likely to have attended their annual well child visits since coming to live with their kinship caregiver. 5 times less likely to have left their caregiver's home due to placement instability, which is defined here as any reason other than aging out or being reunified with their parents. And 2.5 times less likely to have visited the emergency room, which was estimated to have saved an average of about $1,200 per visit. So these are just a few of the long-term benefits that we found of the case management model. And if you're interested in learning more, please feel free to access our full report at that QR code at the top right corner of the screen, or reach out to me if you have any questions. You can go on to the next slide now.
As Rosalind talked about, the Kinship Navigator program is currently being offered Washington case management model in 12 sites that are based across Washington at different area agencies on aging. Navigators live and work in these communities, making them an expert in local resources. Each site offers different supports based on the needs of kinship caregivers and the available resources in their local areas. Some sites offer clothing banks that started in the corners of offices and are now growing towards warehouses. This allows the urgent funds that Roz mentioned earlier to be used for other kinship family needs. Family events have limitless potential, and our kinship navigators have outstanding creativity to make small dollars stretch. From using YMCA childcare, hosting events at local children's museums, or renting space at parks, navigators are wonderful at bringing families together. Legal clinics have been grant funded to hire low bono lawyers to help caregivers with legal paperwork. Washington also has LARC, or the Legal Advice and Referral for Kinship Care, staffed by 2 lawyers able to give legal advice over the phone to caregivers across the state of Washington caring for kinship children. This wonderful program was funded in the state due to caregivers bringing the idea and need to the state legislature. Finally, support groups are as diverse as the communities that they serve. Some navigators started online support groups during COVID and have never gone back. Others opt for in-person support groups during the day while kids are at school. Some navigators have found success with evening support groups for working caregivers, providing both childcare and dinner. Saying the word support group is easy, but it can mean hours of prep work with mail outs and phone call reminders to make sure caregivers attend. Again, as John shared with you on our last slide, our pilot sites, after a year after participating in the Washington case management model, caregivers were 5.1 times more likely to attend a kinship care support group. And you can go to our next slide, please.
Thanks, Amanda. So before we wrap up, I'll speak briefly about some adaptations to the model that might require evaluation. So one adaptation that has previously been made from the model approved in the Title IV Prevention Services Clearinghouse is the use of a tribal kinship navigator assessment. So our team worked with the Port Gamble Skolem tribe located in Washington state to evaluate the culturally relevant assessment tool so that the tribe could implement an appropriate model for their caregivers and children with the goal of still being able to reimburse their model using federal funds. So this type of adaptation could be relevant to other tribes. And the principal investigator for our research team, Dr. Angelique Day, who unfortunately couldn't make it today, will be speaking at another Generations United webinar focused on tribal adaptations that might be relevant for those interested in this coming up on December 11th. In addition to tribal or other adaptations to the model that would require an additional evaluation element, some other evaluation considerations for those interested in implementing the model might be receiving technical assistance with data collection of fidelity to the existing model and or any new adaptations, along with help monitoring and reporting those fidelity data to ensure the model is being implemented as intended. That's all we have for you today. Thanks, everybody.
Thank you so much. Yeah, turning now to Larry.
Good afternoon, everybody, and thank you to GU, Anna, and Melissa for hosting this today and having us be a part of this great conversation. Glad to see so many people on the call today and a lot of folks that are like-minded, so it's awesome to be able to be with this group today. So I'm with the Children's Home Network, which is based out of Tampa, Florida. We're a standalone non-for-profit that's been around since 1892. We've been a group home for kids in foster care. We license foster homes, and we've been doing work in the kinship space for over 25 years. And we'll talk a little bit about the model that we've designed over the years with some add-ons. And so the kinship interdisciplinary navigation technology model made it easier for us to say kintech. So back in 2012, when the federal government was really infusing money into research and evaluation of navigator models, it was at a time where public benefits were really transitioning from paper and pen to more technology-based to be able to apply for benefits. And we already knew at that time many caregivers were not able to access public benefits or didn't even know how to. So we'll talk a little bit about some of the pieces there and some of the key components. So next slide, please. So back in 2012, we did a randomized control trial with over 1,500 participants. Also, as Anna mentioned earlier, serving both those informal and formal caregivers. And we really looked at some key innovations at the time to add on to the work that we had been doing. And so we really wanted to lean into benefit enrollment. So we had technology kind of set up with our navigators to go out into the home and into the communities to really sit down with caregivers to help them understand the processes, how to apply, what they were eligible for, and really alleviate some of the anxiety and worry about the technology pieces of it. And so we really made it as easy as we could and did that kind of shoulder to shoulder work with caregivers. And I think nationally at the time, only about 10 to 12% of caregivers were accessing TANF. And so with the work that we did and the real emphasis on benefit applications, we were able to get over 75% of the caregivers in the study to complete applications with that hands-on assistance, and over 50% were being approved and enrolled in benefits, in addition to TANF and cash assistance, food stamps, and Medicaid were the three key ones that we kind of focused in on. And then the other key component that we added in was that peer-to-peer navigation. And as Roz and her team talked about, really having caregivers with that lived experience and that trustworthiness of that, of their experiences to share and empathize and really have those connections with caregivers that really could, talk the talk and understood what the challenges were from a personal experience standpoint. Those who had dealt with substance abuse and mental health issues of their adult children, grief and loss due to domestic violence and substance abuse and overdoses. And so really having those peer-to-peers all throughout the program. So in addition to the navigators, we had outreach coordinators, intake coordinators, even some of our program leadership were people with lived experience as kinship caregivers themselves. And so we really found the peer-to-peer component really adept at meeting those concrete needs and really alleviating worries and fears about benefit applications and enrollment. And so that was a real key for us. The other piece was interdisciplinary team development, really cutting across all of these silos, because as you guys know, many families have to deal with so many large systems of care, school systems, healthcare, mental health, child welfare. And so bringing key stakeholders to the table to help navigators and caregivers navigate all of those services really help break down some of the barriers and silos and really improve the experience for caregivers, kind of smooth out the pathway for many families. And so those have become a real key component of the work that we do to really work across many systems. Next slide. So when we look at the outcomes that we really targeted and the improvements and looking at the efficacy of the model, we really aligned well with the child welfare CFSR goals from throughout child welfare, really improving safety and permanency at 12, 24, and 36 months post delivery of navigation services that were verified with state administrative data. We were able to demonstrate improved caregiver well-being, improved protective factors for those children in their care, improved, again, application enrollment of those financial benefits, and an increase in the percentage of children being placed with relatives as their first placement throughout Florida, because we have a very high threshold in Florida. The goal statewide is to have 65% of children that may have to be removed due to verified abuse and neglect go to relatives first. So Florida's really made a push to be really a kin first placement and state, and really emphasize that. And really since 2019, we've been licensing relative caregivers and increased resources for family finding here throughout Florida. Next slide, please. So a couple of add-ons that we've developed over the years that we've layered on top of our navigation program is our Kin as Teachers, which is an early childhood intervention for kin. So really caregivers who have children birth to 5, we really saw the struggles because maybe they hadn't parented in quite some time. They were also getting children with emotional and developmental lags and delays due to maybe abuse and neglect. And so we really designed really an evidence-based approach that kind of was an adaptation of parents as teachers to really lean into how do we help educate caregivers on developmental milestones? How do we make sure they had the tools that they needed to be successful, to make sure that those children were developmentally on track and then entering kindergarten ready to learn? And so we really mounted that on top of the navigation services. So any caregiver that had a child 0 to 5 has now a developmental specialist that they get introduced to that can provide some modeling, really look at the home environment to really help them be as resourced as they can be. And sometimes that's just simple things such as appropriate bedding, and resources for safety and well-being, because we still were seeing a lot of families where there'd be co-sleeping happening. We really wanted to emphasize child safety early on, especially for those young ones, because many caregivers, even today, I still get referrals for those children coming right out of the hospital from those substance exposed parents and substance exposed newborns. So really making sure caregivers were educated and supported in this early childhood space is important, because those kids are at most risk for abuse and neglect. And so the other piece that we also looked at from a caregiver standpoint was self-care for the caregivers. So we developed a time for me self-care model that really looked at improving knowledge and practice of healthy behaviors for caregivers. And it was co-designed with caregivers along the way to design the model. And we did a randomized control trial to look at the efficacy of the intervention with families, to kind of look across 6 domains of self-care that were really important, that included things such as self-care, uh, quality sleep, nutrition, stress management, things of that nature. And so those things have been layered on. Next slide, please. So some of these adaptations, we've been able to do some evaluation, and we've been able to get some of this work published. As you guys have heard, many of the programs are now in the Prevention Services Clearinghouse, and we're also in the California Evidence-Based Clearinghouse, and they'll be adding some of those add-on program features into our kind of posting on their website. So if you go to the last slide on my presentation, there are some recently published articles over the last 5 years which kind of target some of those outcomes that I was mentioning earlier, looking at the self-care, time for me, the kin as teachers piece, and the peer-to-peer as well. So for folks that are interested in learning more about the model, we designed a website and a web page specifically to learn more about the model, how to acquire an opportunity for replication of the model in your area. So there's a spot for inquiries. We'll talk more about that in the Q&A opportunity. So if you need more information, feel free to reach out. It's been a pleasure to be with this esteemed group of folks that have been doing this work for the better part of 2 decades. And thanks again for the opportunity today. So I'll pass it over to my next group of colleagues.
Thank
Hi,
you, Larry. Go ahead, Ellie. Thank you.
thank you. Hi, so I'm Dr. Ali Caliendo. I'm the founder and executive director of Foster Kinship. And with me today, we have our deputy director and really the director of all things model implementation, Leah Dodds. And we are very grateful to be here to share our evidence-based Kinship Navigator model that we've developed in partnership with thousands of kinship families in Nevada. And our model was built intentionally to meet the needs that we heard from families and create safe, stable pathways for children to heal and break cycles of generational abuse and neglect. So before we begin, I just want to ground us in sort of a basic truth of kinship care, and that is that it really doesn't happen in neat categories. We know that families move in and out of child welfare involvement all the time. And even in the same household, you might find one child who's in kinship foster care, another child who's in legal guardianship, and maybe another child who's just sort of living with grandma for the time being. What we know about these families is they need consistency and clarity, and that's what our Kinship Navigator model delivers. You can turn to the next slide, please. So the foster kinship model is delivered through a nonprofit public partnership. We are closely partnered with the 4E agency as well as Division of Social Services and other agencies that provide resources for kinship families. But we act as that sort of nonprofit entry point, and we are a bridge to the services that can often feel scary or overwhelming to families. And really, trust and hospitality are at the core of our model approach with families. This is a trauma-informed program structured to increase stability for kinship families across formal and informal kinship care settings. While a lot of families will come to us through referrals in our partnership with our child welfare system, either at the investigation stage or even at the foster care stage, we know just as many kinship families end up caring for children outside the system, and even more begin completely informally with no child welfare involvement. So our model is not system-based, it's jurisdiction-based. So if a caregiver is raising a relative's child with no parent in the home and they live within a service area, we can serve them. So for us, we serve the entire state of Nevada. There's no foster care case or court order required. There really should be no barrier between the family and receiving accurate information from our program. And then the heart of the model is our peer professionals. These are the staff who are professionals, but they have lived experience as kinship caregivers, have grown up in kinship care, or come directly from child welfare. And these are individuals who are able to speak that language of relatives raising children. The lived experience creates more immediate trust, and we understand that families need someone who understands what it feels like to get that call at 2 a.m. and suddenly be parenting again. And then our North Star is stability, and it's in 4 domains: legal, financial, emotional, and parenting stability. And we know from research and practice that unless all 4 of these things are addressed, kinship caregivers can end up feeling overwhelmed, unsupported. I mean, a grandmother can't pursue legal guardianship if she's spending 10 hours a week trying to figure out what benefits she's eligible for. She can't be emotionally present for her children if she's trying to keep the lights on at home. So our model is designed to meet the full ecosystem of need and not just one piece of it. Next slide, please. So like I said, our model works to improve outcomes in 4 domains: legal capacity, financial stability, parenting and child community connection, and caregiver emotional support. And each family who works with our model will receive customized information referrals of those 4 domains. We use a story-based intake and assessment process, and then we utilize our proprietary resource locator tool, which is a tool that matches a family specifically based on their age, the age of the child, their relationship to child welfare, their zip code, and any special needs of the child, to give a customized set of resources. So we understand some caregivers might need just help gaining legal capacity and needing emotional support, while others are going to need help in all 4 areas. We're going to walk families through every step. We're going to connect them to available resources, and we keep the process safe, clear, and manageable. Families then opt into case management, where a dedicated peer professional family advocate will walk alongside them until the family set goals in those legal, financial, community connection, and emotional support domains are met. However, case management is not a required part of the model. All families are going to receive information referral and support, and case management is based on the family's willingness to participate. Our evaluation did not look at the difference between information referral and support and case management. We looked at the difference between families who had received a meaningful dosage of this model compared to families who had not. So not every family will receive exactly the same thing. And we've learned over the last 15 years that what changes outcomes for kinship families isn't just the services, but it's the timing and accuracy of information. We have this rooted in transaction cost theory when we develop the model, but we know that kinship caregivers spend enormous amounts of emotional and cognitive bandwidth trying to navigate systems that weren't built for them. So we know by giving them the right information at the right moment from someone they trust, as well as offering a dedicated family advocate if they so choose, we can reduce bureaucratic friction and free up their mental space to focus on parenting, not paperwork. And when that happens, we're going to see a greater uptake of the available financial support, such as TANF, KINGAP, SNAP, Medicaid, childcare subsidies, kinship licensing. We're going to see more stable households, making sure those bills are paid, there's food on the table, it's a calmer environment. There's an increased psychological capacity to nurture and connect with children, and fewer disruptions from kinship placements into traditional foster care. So the return on investment is both immediate and long-term. Next slide, please. Okay, so for those of you who are evaluating whether our Navigator model is feasible, here is what we provide and measure, and this is based on social support theory. These services, these types of support are offered at both the information referral support level and the case management level. So it just is going a little bit deeper on that case management level with someone who will walk step by step with someone from start to finish. But regardless of what level families are accessing support, we're going to offer informational support. This is the website, the resource locator tool, the helpline, our resource center, making sure that families have that accurate information at the right time. And we offer tangible support. So assistance with notary, copy, mailing services, filing services, vital record payments, and then as available, tangible needs like diapers, car seats, other safety items for the home. And then technical support, that really is that case management, completing applications, getting it turned in, walking alongside the family with some of those challenging and frustrating bureaucratic moments that they encounter. And really, our model is, hey, whether we're over the phone or in their home or they're in our office, let's both get a cup of tea and let's sit and do this together. We're going to explain start to finish what everything means and how to fill these things out so that you just get it done and can focus on what matters. And finally, emotional support. So we offer peer support groups, trauma-informed trainings, behavioral workshops, one-on-one peer support with our family advocates. Whatever the family needs, we are working to build up their social network so that they have a lot of folks to rely on and they don't feel so alone. Next slide, please. Okay, so what we're tracking for fidelity. So our fidelity baseline is really going to measure the percentage of case caregivers who complete these case plan goals. So if a caregiver needed legal capacity at the start of intervention, by the time that intervention is over, they should have achieved legal capacity. If they needed some financial support, whether it be TANF or kinship licensing or KingGap or childcare subsidy at the beginning, 80% of those caregivers by the end will have achieved the financial support. Community connection and emotional support, 90% or more of families should have been actually connected to resources that build their capacity to care for children and are actually utilizing emotional support services. So these goals, again, are really corresponding to real outcomes. So acquiring legal guardianship, securing new income, children are actually participating in therapeutic services. Caregivers are actually participating in emotional support services through a measurable uptake. And these outcomes demonstrate that even some short-term engagement through our Navigator model will create measurable changes in family stability. We measure this all very simple. It's binary case plan. So you start a case, you don't have legal capacity. By the end, you have it. You have achieved that goal. So it's a simple data tracking system. And then two independent quasi-experimental studies have evaluated our model. And compared to similar caregivers who did not receive a meaningful dosage of Kinship Navigator services or received no dosage at all, caregivers who did receive it were 3.4 times more likely to access the financial and training benefits of becoming a licensed kinship foster parent, and also opening up that KinGap option, which we know is really important for states. 1.71 times more likely to actually be receiving the child-only TANF benefit. And this is one of the only financial resources available to our informal kinship families. So it's very important that they're able to access that benefit. And then most importantly to us, children were 3 times less likely to experience placement disruption. We want children to stay with their family when they can't be with their parents, and we want to make sure that family has everything they need to make sure their home is safe, stable, and nurturing. So the result is that we believe when families have accurate information, emotional support, and a clear roadmap, they stabilize. And when they stabilize, children are more likely to stay safely with kin. Just cost estimates, because we know for states who may be exploring implementation, it will help to estimate how much it actually costs to implement our model, as opposed to the cost of just bringing on an evidence-based model. We estimate that for every 1,000 new kinship families the organization would serve annually, it would require approximately 5 full-time Navigator-related staff. So if you're anticipating fewer families, you can reduce it. And if you're anticipating more families, you would increase it proportionally. And we have a tool that helps estimate actual costs. Direct costs are low, mostly printing, mailing, notary services, and then overhead, of course, rent, basic office equipment. This model can be delivered in office, in homes, over the phone, or using other remote tech. And actually, our total cost in Nevada is around $500 per child. So for an intervention that reduces disruptions and increases stability and strengthens relatives' caregiver capacity, we do believe this is a cost-effective approach. And we know what families need and what they deserve is a clear, trusted, trauma-informed system of support that meets them where they are, whether they're in the child welfare system, stepping out of it, or doing everything informally on their own. So now I'm going to hand this off to Leah, who is really our implementation guru, to explain more of what this looks like in practice.
Thank you, Allie. We can go to the next slide, please. So everything Allie's talked about so far is the core of our Navigator model. So what is actually included? And so this is part of my work and really figuring out all things kinship about the jurisdiction so then I can develop the core components. So we work really closely with the jurisdiction and the nonprofit partners to first create a mapping assessment of all of the resources. So what already exists for kinship families. From there, we determine what are the specific client profiles. So what are the different kinship family types in that jurisdiction? Every jurisdiction is a little bit different. Sometimes they call it different things. And then we match that with our resource locator tool, like Allie mentioned before, which is just a very specific tool to figure out what resources do families qualify for. So it really takes the guesswork out of it for our family advocates that are implementing the model, maybe professionals that are accessing it on a nonprofit's website, as well as families too who might be accessing it. We do provide data tracking tools, so this can look like spreadsheets all the way to the add-ons, which I'll talk about in a minute. We also provide a cloud-based toolkit that has all the relevant information, applications, referral form, and different processes tied to the jurisdiction and accessing resources. We develop a roadmap for formal kinship families. So what does it look like to walk through the child welfare agency for families? A basic video library that has anything that you might need related to kinship families, pre-screens for legal and financial resources. So again, it takes the guesswork out of it for family advocates. And as Allie mentioned, accurate information at the right time is, at the heart of our model. And then an updated Kinship Navigator manual that is specific to the jurisdiction and has links to all of these things that I mentioned before. And all of that is really supported by 80 hours of training and technical assistance and coaching for the nonprofit implementation staff. So we really want to utilize these tools to support in the fidelity and ongoing support of kinship families. And it's tailored to the unique needs of the jurisdiction. So my goal is not to make the jurisdiction fit within the model, it's making the model fit within the jurisdiction, right? And every area has, different nuances, different kinship family types, different resources. And so we think that's really important to really figure out what those nuances are to support those family advocates and nonprofit partners. And then some of our program add-ons. So these don't necessarily require our support, and it might be dependent on, what the nonprofit partner already has going on in their organization. But some things that we can support with are, just caregiver basics and stabilization. So resource center basic needs. We started with a very small closet that was also our break room, and now we've expanded into an actual resource center that is much larger. So, we love to coach nonprofits on how to get there if that's what they want to do. As well as, respite care. That is a big need for a lot of families. And we've piloted a respite program and now successfully have it ongoing to provide brief respite care for relatives. So, we love to support our partners with really accessing the best support available for families if they'd like to. And then data, we're really big on data. So like I mentioned, we can provide different spreadsheets, but we often recommend our nonprofit partners to utilize Salesforce. And we already have a Salesforce build, so they can opt to get a free nonprofit package that has 10 free licenses per nonprofit. So it's very cost effective because it's free until you reach, 11 users. And then we transfer our build, which is, perfected to our model and has all of the metadata and objects that are required to meet the fidelity requirements and really just have really good data tracking to understand the climate of kinship care in the jurisdiction. And if the nonprofit already has a data system already in place, then we can provide our metadata and provide support in, implementing that into their current existing CRM. And then we're also really big on community and advocacy, so we can provide support to how to implement a kinship advocacy network, which is just a group of caregivers that we, utilize to raise up their voice and create positive policy practices. So this is a big aspect also of like our technical assistance. We talk a lot about policy and different barriers that caregivers may be experiencing in that area. Next slide, please. And then for implementation, which I'll just briefly go over. So we have 4 stages of implementation that we walk through with the jurisdictions and nonprofit partners. Stage 1, we're really strategic planning, where we're trying to figure out how does the jurisdiction intend to utilize the model, how many nonprofit partners are they going to be utilizing, and then we can also support with the SOW or RFP, and then move those into licensing agreements with us to utilize the model. The deep dive is my favorite part where I learn everything about kinship care in the jurisdiction so I can start creating some of those deliverables. And this is really where I also lean on, not just what I find on, the internet, but also the experiences of nonprofit partners and state agencies to fully understand the climate of kinship care and resources. And then capacity building. So sometimes our nonprofit partners have not necessarily worked with kinship families. So we not only capacity build for the model, but also just kinship care in general. So they really understand, the nuances of kinship care and the needs of families and how to meet those needs. And lastly is implementation and monitoring. So we do stay involved through monthly fidelity checks to see, are we meeting our baseline requirements? We create a dashboard for the jurisdiction, and once we run those reports, we share it back with them. This also includes ongoing technical assistance. So typically we're meeting about at once every month with the nonprofit partners. And then we also offer ongoing training, refresher trainings to just make sure that it's continuing to be utilized and that we're there to provide support to those nonprofits. And again, our goal is not to really fit, our goal is to fit our model within the system that's already existing and also highlighting the good work that is already happening within the jurisdictions if they are serving kinship families already. Next slide, please. So the QR code or the link, you can find more information about our model. You can see our nonprofit and state partners and also just different data, as well as our evaluations if you'd like to read through those. And then, of course, our contact information. You can reach out to me if you're interested in knowing more, and we can definitely set up a meeting to talk about what some of the needs are in your jurisdiction. And that's all I have, so I'll pass it back to Generations United.
Thank you
Melissa.
all so much. We really appreciate you coming in. I want to thank you all so much for managing your time. You had a lot of information to cover in a short period of time, and so thank you so much. We, in a moment, are going to be moving over to a Zoom meeting format for our Q&A session. We'll be putting that link in the chat. This will give us an opportunity for some deep dive on the conversations, and we will bring over the questions that you've posted in the chat. So please join us. We'll be running for another 30 minutes for our Q&A session. Upcoming next month is on December 11th from 2 to 3:30. We're going to be hosting another webinar on this particular topic, but it's going to be focused more on opportunities for tribes. So please join us. For that, you can register on the QR code, or you can click on the link that is in the chat.